Hello, everybody. Thank you for joining us for our lunchtime session. We have our Advocacy 101 presenter, Public Policy Director, Tommy Hernandez.
Thank you so much for the introduction, Denise. And again, thank you to everybody out there who's tuning in right now. I want to thank you so much sincerely from myself and from the chapter for giving us your Saturday to learn all of these great topics that have been included in the programming from start all the way through the finish. We've all been very excited about the content that we've been able to share with you guys. And this is something that I'm also particularly excited because as the public policy director, I often get asked, what is really the scope of work? How does public policy and advocacy, how are those two related? What's the difference between the two? So I thought we can use our time together today to go and describe what my work is as a public policy director, highlight some successes, talk about how you could get involved as an advocate, the many ways you can get involved in that as an advocate. But then we're also going to take a close look at really what Advocacy 101 is. So today, sit tight. We're going to do an Advocacy 101 for the next approximately 30 minutes. And please know I will do my best to manage my speaking time to make sure that we do have adequate time at the end of my presentation for some Q&A. So please don't be shy. Put the Q&A. Denise will read those questions to me at the end. I'll do my very best to go ahead and answer those. So let's go ahead and get started. I'm going to go ahead and share my screen so that way you guys can view my PowerPoint presentation. So give me one moment. Let me go ahead and transition to that.
While you do that, Tommy, I just want to thank our sponsor, Preferred Assisted Living, for sponsoring this lunchtime session.
Absolutely. Thank you so much again to Preferred Assisted Living for helping make my my lunch session possible. So let's go and get started. Like I told you guys, we are going to get started today with Advocacy 101. So I'm going to go and advance to the next slide. But first, before advocacy, we need to talk about public policy. So let's go ahead and do a highlight overview of public policy before we do a deep dive into advocacy. Public policy is the umbrella term for everything we do, everything I do in my role as a public policy director. When we core part of my work on a day-to-day basis. When we do any one of those things, folks, we are working in the arena of public policy. Now, I also want to go and draw your attention to some information that is on the right side of each of the slides that you're going to see today. That is 52886, text AIM to 52886. Quickly, what that is I'm going to encourage you, if you are interested in learning more about advocacy, text the word AIM, A-I-M, to 52886, and you will get prompts right back to your mobile phone that'll collect information from you. And all that information will get forwarded to me, and I can go and connect with you, and we can begin the discussion of how we can best get you involved, what works with your availability. So again, this is going to be on every one of the slides, and I really hope by the end of it, I've encouraged you to take action on that and have that discussion with me on how we can get you involved. So let's go and advance to the next slide. Advocacy 101. Like I said, exactly why we are here for the next 30 minutes. Broadly speaking, advocacy is the coordination of volunteers united behind a single cause. At the association, grassroots advocacy mobilizes a wide network of volunteers to advocate for public policy changes to their elected leaders, their elected officials. When we say elected leaders, we are talking about our members of Congress, we're talking about our senators, we're talking about members of our state legislature as well. So I'm going to highlight two of our advocacy programs. The State Champions Program launched in 2018, and it is the backbone of our grassroots advocacy efforts for state government. Again, we are advocating directly to our policymakers and our elected leaders. And again, State Champions is the backbone program. And the reason why it's been so successful in just its 2 short years is because we borrowed a lot of the knowledge, a lot of the approaches that have been tried and true and proven in our next program that I'm going to highlight for you. That is our Advocacy Congressional Team, also known as ACT or ACT. This program is specifically for our federal advocacy. These are the folks who are engaging, emailing, calling, tweeting, Facebook to our US senators and our representatives. So again, when we were beginning to design the State Champions program, we took a lot of what we learned to be successful from the federal advocacy work and instilled a lot of that together. So our State Champions program is really making some significant accomplishments, robust solutions all across the state, and even so here in New Mexico. And we'll get to that in a few slides. So I want to talk a little bit more about our State Champions program. This is really what I wanted to highlight today, and this is what I really hope you, by the end of our conversation here, end up being interested in. So jump into that. State Champions, the journey to end Alzheimer's runs through state capitals. For many, many years, we have engaged at the federal level, meaning we have walked the halls of Congress whenever we would have our advocacy forums in Washington, D.C. We would meet with our members of Congress here in district. So State Champions, we know that the journey to end Alzheimer's also runs through state capitals, not just through our nation's capital in Washington, D.C. So while the Alzheimer's Association has long provided cost-free resources to families, we know that state governments can and need to do more to meet the growing prevalence that follows this disease and its burden. This is where the important role of State Champions comes in. Champions engage with their state legislators to help pass legislation that would help people with Alzheimer's and caregivers. State Champions are the voice for the 43,000 plus living with Alzheimer's and 108,000 caregivers. I want to go and pause real briefly there and say, after this past election on Tuesday, every one of our state legislators was on the ballot, and every one of you out there is represented by a member of the House of Representatives in the state, in the Roundhouse, and you also have a state senator. So every single person out there has two representatives in the Roundhouse, a state senator and a state representative. So we are going to be engaging with them as we have over the last 2 years, even more so in this upcoming session, with the importance of addressing these needs now more than ever. So again, the State Champions program is something that we look forward to growing and building on its success. So you heard me talk about the State Champions program and why we have learned it to be effective, and how we are employing a lot of the tactics and approaches and strategies from our federal advocacy. But I thought it was important for me to bring to you the voice of a state representative from House District 27. So for any of you who are familiar, you see on the screen, he is a member of the Health and Human Services Committee. And that's an important note because almost every single piece of legislation has to pass through several committees. And these committees, their responsibility is to ask the tough questions, to really dig into the weeds of any bill that is asking to get passed by the legislature and make its way to the governor's office. So State Representative Marion Matthews, I thought, was an excellent figure for us to reach out to and ask her to say a few words on what a legislator's perspective is on grassroots advocacy. So I'm going to go ahead and hit play, and we're going to go ahead and this should be about 2 minutes, and then I'll go and come right back to you guys. Hang tight.
Hi, I'm State Representative Marion Matthews, and I thank you so much for the opportunity to share my perspective as a state legislator on the importance of advocacy and the impact it can have in the Roundhouse. Advocacy helps legislators understand which bills are important to constituents. Because of that, your advocacy, first of all, helps us identify our legislative priorities. Secondly, it helps us make a better informed vote. Third, it helps us decide how to vote to best represent our constituents. And fourth, if we don't support or vote how you would like us to, it keeps the dialogue open so we can find a compromise that works for both of us. Hearing directly from the people we represent has a significant impact on how far a bill may get during the legislative session. Bills that pass the legislature have a strong advocacy network behind them. The prevalence of Alzheimer's and other forms of dementia is rising across the state. Legislators may be able to help tackle the large burden this is creating. When we hear directly from you, You help us understand its impact on real people, real New Mexicans like yourselves. I encourage you to get involved with the Alzheimer's Association's advocacy program called State Champions and make your voice heard in the Roundhouse. If you do that, we will hear you. Thank you so much.
Great. Well, I hope you guys appreciated, what State Representative Marion Matthews had to say. And if there's any one thing I hope that you do remember, something that really struck me as something that was a key moment of everything she just said in those brief 2 minutes, was that bills that pass, meaning bills that make their way through both chambers of the Roundhouse, bills that pass have a strong advocacy network behind them. That is the most important tool any organization can have, is a strong advocacy network to mobilize, to contact their state representatives, their state senators, and let them know, hey, please support this bill. Please sign on as a co-sponsor. And above all, make sure that you are voting in favor of this piece of legislation. So again, we appreciate State Representative Marion Matthews' fine words on this topic to help you guys understand what legislators perceive our advocacy to be. So let's go ahead and move on to the next slide. So far you've heard me talk about Advocacy 101, about what my work is as a public policy director. We heard from State Representative Marion Matthews, and you also heard that we have 2 advocacy programs. So again, today's focus of the 2 advocacy programs was on the state champions. So we're going to continue to dive deep into that. What you see now on your screen is we have advancing public policies in the states. Our state affairs team in Washington, D.C. has carefully identified 4 areas that public policy directors all across the footprint of our association, meaning every chapter in our organization, we are pursuing these 4 public policy priorities in that specific order. So just take note of that, please. So increase awareness, early detection, and diagnosis. Well, it may sound pretty self-explanatory, but let me go and dig a little bit deeper into why that is important and why it's goal number 1. We need to do more to educate healthcare providers about early detection and diagnosis. I believe fewer than half of people who have Alzheimer's or other forms of dementia have not received a proper diagnosis. That is something that certainly needs to be corrected. So again, increasing awareness, early detection, and diagnosis. Another thing that is important for our state as it relates to goal number 1 is that we need to do better to conduct culturally appropriate awareness campaigns on early detection and diagnosis. Again, New Mexico is blessed to have many cultures, rich population groups all across our state, Native American groups. We have many Spanish-speaking communities. We have so many different populations within our great state that we need to make sure that we are not taking a one-size-fits-all approach when we talk about increasing awareness, early detection, and diagnosis. So again, culturally appropriate public awareness campaigns is especially important to our state. We also need to do better at collecting data on Alzheimer's disease, cognitive decline, other forms of dementia, and caregiving in general, so that way we can take those data and help shape policy in our roundhouse. So moving along, build a dementia-capable workforce. We can do better to create incentives, career pathways to recruit and retrain healthcare professionals that work in the delivery of care. That could be geriatric nurses, that could be geriatricians, that could be home health aides. We know that the projected prevalence, as it's expected to rise 30% by 2025, we need to make sure that as the prevalence increases, so is the workforce who is adequately trained to care for these people. So that's why building a dementia-capable workforce is extremely important, not just for our state, but for our country. So another thing that we could do as far as building a dementia-capable workforce is to require training for adult protective services, workers, and law enforcement on effective intervention in cases involving individuals with cognitive impairment. Now, we've made some tremendous progress with updating a silver alert notification bill. We've been having great conversations with law enforcement agencies with the help of our chapter executive, Tim Sheehan, making some movement on that front, and me working with the aging department on getting their adult protective service workers trained and modernize their curriculum. So I just want to quickly note a couple points of of achievement that fall under goal number 2. Increase access to home and community-based services. We know that New Mexico is a very rural state, and many of our caregivers, perhaps many of you out there listening in right now, understand this very well. We need to do more. Our state needs to do more to increase, improve, invest in home and community-based services. What this could look like, for example, is that we can provide Medicaid coverage for person-centered dementia competent and dementia-specific care across care settings. We also can update Medicaid eligibility requirements to allow the people who are already accessing rather, home and community-based services. We want to make sure that those people are not being disqualified because of an age requirement, or they're not being disqualified because of an income that perhaps is just outside of what that eligibility guidelines are. So when we talk about increasing access, we are talking about eligibility in many of the ways when we talk about goal number 3. And to quickly cover goal number 4, we need to do better to protect persons with dementia who have behavioral issues, perhaps severe mood swings, which we know is a common, a common symptom of Alzheimer's dementia. We need to make sure that people who are in residential care settings are not being improperly displaced from that residential setting. So we need to ensure, again, that these people who may demonstrate some of these behaviors are not rushed and improperly displaced from that care setting that they so much need and rely on. So those are the advancing public policies in the states. Again, these are the 4 core areas, the 4 core items that our public policy directors across the country are working with their state champions to advance in this particular order. So the next slide I have here is going to talk a little bit about the New Mexico state plan. So our state, New Mexico, has a state plan to address Alzheimer's disease. It is really managed and administered and created by the Aging and Long-Term Services Department. And they are tasked to do an update every 3 to 5 years. And at the time when we do the update, we carefully evaluate that state plan for its effectiveness. We carefully evaluate the progress, or perhaps where some of the areas of improvement lie. And I mention this because the Alzheimer's Association is a key player in helping the Aging and Long-Term Services in the crafting of this state plan. We are the subject matter experts in concern and awareness, care and support, public policy, and many other facets of addressing Alzheimer's disease in our state. So we're very excited to be at the table once again. The work is currently underway, and the work that we have begun will be for a 2021 update to that state Alzheimer's state plan to address Alzheimer's and other related dementias. Now, after this, I encourage you, after this presentation, when you have time, I encourage you to please visit the virtual booth of the Aging and Long-Term Services Department, because it is at that virtual booth where you can fill out a survey that we have designed that'll help us identify people, caregivers like yourselves, to invite them to the table so we can make sure that when we are working on this state plan, we are hearing your top concerns directly from the caregiver. So again, I encourage you guys to go visit that virtual booth with the Aging and Long-Term Services Department when you have a moment. Let's go ahead and move on to the next slide. I want to go take just a few moments to do recent achievements. Senate Bill 42 in 2019 was introduced, it was passed, it was signed. In fact, it was the 50th bill signed, and I believe there were 1,700 total bills introduced in 2019. So that speaks to the effectiveness of our advocacy network, of our State Champions program, even in its inaugural year of 2019 session. So what did the Silver Alert Enhancement Bill really do? Well, number one, it eliminated the minimum age requirement. So whenever somebody was reported missing, they had to meet an age requirement, even if they had Alzheimer's dementia. Well, we felt that definitely needed to be modified. So we were successful in including that in the bill. So now any missing person who has any form of cognitive decline is now eligible for that Silver Alert notification. House Bill 225, moving along the timeline here, just this year, earlier this year in this 2020 legislative session, a milestone bill known as the Kiki Saavedra Senior Dignity Fund. Perhaps you have heard of it through our social media pages when we were advocating. It also made a lot of news in newspaper, print, television media for this specific bill. So this bill, with our advocacy behind it and our good friends over at AARP teaming up to get this heavy lift across, we were able to deliver a milestone investment to improve and deliver high priority services for seniors all across New Mexico. So this is one of my favorite slides because everybody you're seeing here in this picture, this was taken earlier this year. I believe it was February 5th because that date was such a milestone day for our state champions. So earlier this year during the legislative session, we had the opportunity to receive an invite from the governor to come up to her office and discuss the issues, discuss the things that caregivers, that people with Alzheimer's and dementia need in our state today. So this picture here, obviously you see our Governor Michelle Lujan Grisham at the head of the table underneath the seal, and everybody around there is a supporter. Everybody there in that picture is an advocate. And I want to note that you are going to see to the left of the picture, which would be to the governor's right, there are several state legislators there from both sides of the aisle. Alzheimer's is purple. It is not red. It is not blue. Alzheimer's disease is a nonpartisan issue, and our advocacy program reflects just that. So that was a great day. Of course, we know that there will not be any in-person meetings this next legislative session, but I thought it was still important to show you the successes that we've had in just 2 short years. Perhaps some of you were there in that picture or were there that day. So I'm going to go ahead and conclude here so we can get to some questions and comments. On the screen, obviously, you see my name, you see my title, you see my email address. If you don't have any questions today, but some do come up, or if you prefer to talk offline with me about them, please go ahead and send me an email. I also, again, want to draw your attention to please submitting AIM to 52886. Again, you submit a text in the body, you write AIM, and the number you're going to text to is 52886. Again, that will just put you in the I'm interested more lane, if you will. That'll put you on that track. And that's when you and I can have conversation and learn what is the best way to get you involved as an advocate. Denise, if you want to go and take a look at the chat and relay any questions to me, I'm happy to take them.
So there are no questions. There's just kudos and thank you in the chat room that's listed so far, Tommy. Do you want to let them know that you do have the survey link on your files tab next to the chat?
Thank you so much. So Denise just informed everybody watching that that is included in the chat. Is that correct, Denise?
Yes. So if you actually see, there's a couple tabs. You have chat, polls, people. And if you click on the files tab, there is a survey there.
Great. So you can access that directly here now, or you can, again, go back and visit the virtual booth of the Aging and Long-Term Services Department. I just strongly encourage you to do 2 things, if anything at all, from our presentation. 1, text 5288, text AIM rather to 52886, and also please take a look at that survey. It's very brief. It just collects a little bit of information from you as far as what your concerns, what your needs are. That feedback is significant to us when we begin to craft this plan, and we will be asking some folks who do complete that survey to join us as we move forward with designing and finalizing that plan. So again, please give consideration to those 2 things. I want to thank everybody for their time. Thank you to my moderator, Denise, for doing a wonderful job as she has been throughout the conference. I'll go and conclude my presentation. Thank you again.
Thank you, Tommy. There's no questions. Thank you all for joining us. Have a great day.